Hello, Shelby. I'm Mr. Logan with Concentra. Thank you for coming today and being a part of this interview. Um Tell me a little bit about yourself, real quick, and what do you like about Concentra? Let me ask you that first.
Concentra, I like that it's a really big company, and that it's not that you have the room to maybe move up in the company, and it's not like a small mom and pop or a privately owned physician clinical type setting. Could you have the room to maybe move up or move into different aspects of care?
Did you do any homework on Concentra?
I did. I think like that kind of goes back to that y'all are a really big company. There's space to move up. They're all over the country, and that there's different things to do. Because my end goal is nursing school. Medical assisting is just kind of my stepping stone to get there, and I like that I can move up within the same company and move into different roles and do different things with it.
And the job you're applying for?
Medical assisting.
Okay, so we're both on the same page then. Okay, I want to make sure of that. What drew you to the medical field?
As a younger child, I liked animals and like seeing how those things worked, and like I rode horses for a very very long time, and I got like really interested in the veterinary aspect and their care, and then so like that kind of started to transfer more to people and like the anatomy and physiology and how all of that stuff the body works. It's always just something I very have found very fascinating, and it's just something I really really enjoy.
Okay. I see that although you're a recent graduate, I noticed you have some internship under your belt. What clinical procedures were you responsible for?
Everything from drawing blood, phlebotomy, to injections, counseling patients, vital signs, patient histories, um, just, I mean, kind of all of that basic stuff you'd go into the doctor's office. And not quite the doctor, but the nurse or the doctor's assistant, um, those type of things.
What office procedures were you responsible for in your internship?
Answering phone calls, scheduling patients, insurance verification, taking co-pays and payments, scheduling appointments. If doctors needed to go into surgeries, we dealt with calling the hospital and getting those set up.
You have any experience counseling patients?
Yes.
You want to share any of that?
I view kind of counseling patients as not quite as some people would think as like a psychiatrist type counseling, but say you've just given them a medical diagnosis, kind of explaining to them like more what that is, answering their questions, helping them with how to take their medication and things like that.
Okay. Are you familiar with taking patient history and vital signs?
Yes, that's one of the first things we were taught in medical assisting school, and one of the most important things in our internship. If you don't have that, you don't have anything.
What steps uh, what steps to take to protect patients' right and confidentiality? What do you know about that?
That's another huge thing that we were hit on. We were drilled on, and in our internships, as HIPAA is one of the most important things. Patient confidentiality is very, very important. One of the things we were taught was when you go pull a patient out of the waiting room, don't call them by their first and last name. Just call them by their first name, because someone in the waiting room could hear their first and last name or go look them up. Um, you don't talk about them outside of work. Um, just things like that. That's what happens in the office stays in the office.
Do you have any computer skills, and if so, can you enlighten me on them?
Yes, I'm very proficient in the Microsoft Office suite. I've worked with like some different like medical programs, patient like the health software. I can type over 40 words a minute. I'm very confident with a computer.
Do you have any experience with healthcare, electronic healthcare records and software?
Yes, Athena is the one I have the bulk of my experience with.
Okay. What do you like most about being a medical assistant?
Just the day to day, like hands on contact with patients. You're generally not going to see the same thing every day, but it's not a super crazy situation. More, it's not a trauma situation. You really get to like build a rapport and you get to know your patients. It's a more personable relationship.
What do you like the least about it?
how some people view the medical like assistant type job. A lot of people I feel like view it as like a bottom feeder type job when it's really not. It's actually very important.
Okay. What do you plan on doing about any continuing education?
Attending seminars, different conferences, but I don't plan on just leaving it as that. I feel like keeping up on reading, like peer-reviewed journals, different forums, and things like that can be very, very important as well.
What kind of work schedule would you like to have?
Just your typical doctor's office clinical schedule, like your 7, 8 to 5, Saturdays as needed.
What are your personal weaknesses?
Tend to be organized to a fault. I spend so much time on it that I end up rushing other things at times.
What are your personal strengths?
Always make sure I get the job done. Like I said, it's my weakness that I get organized and I spend so much time on it, but I always make sure that I do end up getting my job done.
Well, thank you for coming in for your interview today. We'll be back in touch with you.
Thank you.
You're very welcome.